Hello, my darling. I'm Dr. Gabsy. Thank you for coming in today. I know that must have been so hard for you, but this is a huge first step. And you should be proud. Admitting you need help is such a difficult but important thing to do to start this process. I'm so proud of you. Now, I'm going to continue to whisper or talk low because I've found it helps people feel at ease. We're going to take our time now and get through this together, however long it takes. I'm going to set a peaceful mood here. I'm talking quietly. I have a candle lit because I can see that you're anxious, but trust me, this will all be worth it. I'm going to ask you a lot of questions to gauge where to start your treatment, but if you need a second, please tell me. I need pure honesty from you, okay? And as many details as you can give me. I have tissues here. I have some tissues. And if you need anything else, please let me know and I'll get a nurse to get it for you, okay? Just know this is a safe place without judgment. I just want to help you, okay? So first, we're going to answer a couple questions. It's quite a few questions. This is going to be a long and tedious process, and I'm sure you're exhausted. I know you already answered a good amount of these when you got registered, but it's necessary for me to ask them again. As much as a pain it is, let me just get my stuff up here now. Where is it? I'm sorry. This'll do. Alright, can I get your name, please? Alright, and your date of birth? Okay. What are your preferred pronouns? Alright. And who is your family doctor? Okay. Some of these are going to get really personal, and I apologize, but we have to ask these, okay? What is your sexual orientation? Okay. What is your marital status? Okay, and your living situation. Do you live at home with your family? Do you live by yourself? How many people are in the household? Okay. Occupation. What do you do for a living? And where is that? Okay. Do you smoke or vape? Okay. Do you drink alcohol? No. Okay. Do you do any recreational drugs? Okay. And that's fine. That's fine. I just need to know. Do you have any religious beliefs? Okay. Alright. Listen, there's nothing wrong with that. If that's what you believe in, to each their own. What's your diet like? Do you eat healthy? Do you eat not so healthy? A lot of fast food? Okay. What was your childhood like? Uh-huh. Okay. Really? Okay. How do you sleep? Do you sleep okay? Do you wake up a lot throughout the night? How do you sleep? Oh, okay. Alright. What's your personal hygiene like? Because I know when you're depressed or going through things that sometimes it's hard to take care of yourself. And I understand that. How many times would you say you shower, wash your face, brush your teeth? Okay. And I mean, we can help with that. We can make sure that you are washing your face every day and brushing your teeth every day at least. You don't have to shower every day because I know that can be hard, especially in the beginning. But we can make sure that the rest of it happens. So why are you here? What made you decide to come here today? Okay. See. I'm sorry, my chair is obnoxiously loud. So, has that been diagnosed yet? No. Okay. So that'll be my job. Okay. What are your symptoms? Okay. Do you have any diagnosis? No. Okay. What's your medical history? I know we have a file for you in general, but I like to create my own file for all of my patients so that they can give me word for word what's been going on and everything. Anything else? No? Okay. Family history. Does your family have a history of mental illness or any of that? Really? Okay. I know you had mentioned in your childhood about, yeah, you know what I'm talking about. That can cause a lot of your symptoms as well, sadly. Okay. How are you feeling today? I know, aside from the anxiety and everything of being here, how are you doing? Okay. I'm going to give you a questionnaire to fill out, and we're going to review it. Where did my pen go? I had a pen. Here's a pen. Oh, no, here's a pencil. There you go. And you return it to me once you have it done out. I'll review it. Okay. All done? Perfect. Okay. Alright. I'm so sorry. I'm so sorry. I had an early rise this morning. Yeah. An early rise this morning. Okay. That's not excellent. It definitely showed signs of not even depression, which you thought you had. It showed signs of bipolar disorder and potentially schizophrenia. So we will evaluate that more with more sessions. It's definitely troublesome, I understand. But with the right medication and a good support system, you'll be able to get through this. Do you take any medication? No, okay. I didn't think so, but I had to ask. Do you have any allergies? No food allergies or medication allergies, no, okay. What do you hope to get from this? Answers, yeah. Understandable. Treatment, yeah. It's totally all understandable, yeah. I can understand that. Tell me about your daily life. How do you feel day to day? What do you do day to day? How hard is it, you know? I would have just wrote all this out, but it's just neater if I print it and type it up. Excuse me, I'm so sorry. Do you have any coping mechanisms for what you've experienced day to day? It's hard finding coping mechanisms for schizophrenia, but you can most certainly do it. I just want to tell you and remind you that you are not anything that the voices may say. Don't listen to the things the voices tell you to do. They just want the worst for you, and you don't deserve anything that they say to you. You are a worthy human being. You are important, and you deserve the world. What are your plans for the future? Or do you have plans for the future? Excellent. That's amazing. Good for you. Have you ever harmed yourself or thought about not being alive anymore? Self-inflicted? Do you feel like you may do any of that if you weren't admitted today? Yeah. Okay. Do you worry a lot? What do you worry about the most? That's an understandable worry. Do you do anything obsessively? Do you go and lock your door 3 or 4 times? Do you have to turn the oven on and off multiple times? Do you have to knock a certain amount of times, you know? No, okay. Do you have trouble focusing and sitting still? You have trouble focusing, but not sitting still. Okay. Do you have memory issues? Yeah. I figured. It's common with people with schizophrenia and bipolar disorder to have memory issues. Do you ever think of harming others? Can you tell me about it? It must be scary to think those things and hear those things. And this doesn't mean that you're crazy, because I'm sure you're thinking that. It does not mean that. Have you lost interest in your hobbies? Yeah. What hobbies did you have? Oh, those are some good ones. Those are some good hobbies. Excellent. Do you see or hear things that aren't there? Yeah. Do you have mood swings? Yeah. I know you answered some of this on your questionnaire, but it's part of the curriculum, we'll call it. Okay. Do you have delusions or feel paranoid? Do you feel like, for delusions, do you think you're better than everybody else? Do you think something's gonna happen that's not? Like the world's gonna end because of some traumatic event that's, is not happening. Or most people know is not happening. You may not realize that, and that's totally fine. You can't help that. You feel paranoid, but you don't get the delusions typically. Okay, no. What kind of delusions would you have? You think that people are in love with you way too... Okay, yeah. That is a type of... That is a type of delusion. Actually, I keep these things on my phone simply because if I'm out in a public, like the group therapy, I can mention it in group. And I don't usually have my computer in group because we're not in my office then. What is it under? Not that one. This one. The types of schizophrenia. There's paranoid schizophrenia. There's disorganized schizophrenia. There's catatonic schizophrenia, undifferentiated schizophrenia, and residual schizophrenia. But some delusions nothing wrong with going on Google. Can be romantic. It is a thing. Have you ever been known to be promiscuous? Sorry. Have you had unprotected sex? Have you done things promiscuously, sexually, that you normally wouldn't? Because you were in a high moment as opposed to your regular lows? Yeah. Okay. Do you ever have erratic behavior? Yeah. Oh, sorry. That was a little aggressive. Yes, I can. Yeah. When you have those high moments, yeah. Totally normal. Totally normal. It's not that there's nothing wrong with you, because obviously there is. It's a mental illness. But it's normal for your mental illness to be this way. How is your self-confidence? Is it way up here? Is it way down here? Is it up here sometimes and down here other times? Is it somewhere in the middle? Yeah, okay. Yeah. Yeah. Totally makes sense. So, typically, you're only in here for a couple weeks. We start you on a 72-hour hold, where you're not allowed to leave the premises without staff being with you if you have to go outside to smoke. You can't leave the premises at all for 72 hours. Family can't take you out. That's just while we're trying to get you regulated and everything. It's for safety reasons, of course. It's really hard being in here sometimes. But as long as you have the right mentality about it, it should be okay. Keep in mind, some people are in here against their will. They were signed in by either the police or by family, and they don't really get the choice. You signed in here by choice, and that makes all the difference. You want to get better because you knew something was wrong, and that's amazing. My hair is doing something, I'm sorry. That's amazing. Not everybody realizes that. You're doing an amazing thing, and I hope that we can help you as quickly as you're ready to. We're not going to rush you out or push you along. You take as long as you need to get better. So, it's late at night. You're probably tired. We're going to get you brought in, straightened away in what we call the fishbowl room, which is a room right next to the nurse's desk with a giant window, so they can keep an eye on you for the 72-hour hold. And we'll go from there. I will see you tomorrow for our first appointment. I hope you sleep well. Breakfast is at 8 a.m. You have to be out of bed by 7. because you were so late signing in, you don't have to be up that early. They can bring you a special breakfast because it's late. But if you wake up that early and you want to get up, that's up to you. Meals are at 8, 12, and 5. And then you get a bedtime snack. And you go to bed you have to be in your room between 9:30 and 10, and lights out is 11:30. Okay? Whether you go to sleep or not is, I guess, up to you. But if you don't go to sleep, you're gonna be tired the next day. Alright. I'll get a nurse to bring you to your room now. And you get some rest. I'll see you tomorrow, okay? Don't forget, you have to get your vitals done before breakfast. Do that every day, okay? Alright. Good night. I'll see you tomorrow. Hi guys. So, I'm sure you can figure out that I am clearly not a professional in mental health, and it's just a role play when it comes to this video, but it's just something that hit close to home, and I've seen a few people do it now, so I wanted to take a chance at it. I have been into the hospital, so I tried to do it as similar to that as I possibly could when I got signed into the hospital for mental health. And the diagnosis of the patient in my roleplay is actually my diagnosis for the most part. Only thing missing is I also have, aside from bipolar disorder and schizophrenia, I have an eating disorder, and I have generalized anxiety disorder, or GAD. So this is something that I knew I could try and pull off, and I thought it would be a fun little thing, but I just wanted to put the disclaimer that I am not a professional. Do not come for professional advice. I am just a person who has lived through this. I am always a listening ear. I will try to get back to anybody if you message me asking for help or anything, but I am not a professional by no means. I don't work in this industry. I work in a different industry, and while my industry that I work in does help people during some of their hardest times, it is not mental health specifically. But I just wanted to put this information out there that if you are dealing with any of the things I listed off in that video, you're not alone. Reach out to a professional if you can. Reach out to somebody if you are battling with mental health issues and don't know where to turn. Reach out to a friend, a family member, somebody online. There's lots of helplines. I will probably put some in the description for Canadians. I don't know of any of the American ones. I can try and find some to put in the description. But this is absolutely a scripted video. It's not real in any sense, I'm sure you know. But I just wanted to make these things clear. I don't even have the words to describe what it's like to go through these things, as those things are stuff that I deal with on a daily basis that are mentioned in this video. But I have an amazing support group. I have medication. I'm well taken care of. Just know that you're not alone ever in this, and that mental illness is normal. You may not be normal, because I know I'm not, but mental illness is normal. There's nothing wrong with you per se. Yes, there's something wrong in that sense, but it doesn't make you abnormal to have mental illness. Loads of people have it. Even if it seems like you're the only person dealing with stuff like this, because I don't know anybody else who deals with these things. You're not alone. There are other people in this world like you. Just keep that in mind.